The next video is about the choice point. This is adapted from directly from Russ Harris's work, and this is the classic slide that he uses with the choice point being in the middle about situations, thoughts or feelings or teams as in the FACT model, and away moves are taking the client away from their valued direction, and the towards moves are taking them towards the valued directions in their life. The away moves are actions that are ineffective and that they're incongruent with the client's values. They're often but not always associated with experiential avoidance, and that can be due to fusion with reasons, rules, being right, seeking pleasure or urges. They can also be fusion with teams, that's thoughts, emotions, memories, associations and sensations. Towards moves can be seen as positive from the client's point of view, and for example, an addiction may be seen as taking away some of the distress from life, and it's not much point in arguing with people at this stage. The idea of the choice point is to introduce the patient to behavioural analysis, so we're looking at the antecedents, the behaviour and the consequences, so hopefully they'll get the hang of that actually using drugs and food and things isn't particularly helpful for them. Behaviour can be both toward and away, so eating, if you do it with savouring and being mindful and in good proportions, can be a very towards move. Binge eating in response to something stressful in life would be considered an away move. So it's all very contextual. In terms of psychology, we get hooked by difficult thoughts and feelings, and then we do away moves. This is the sort of core underlying principles of ACT. Towards moves are behaving like the person we want to be, so invoking our values. And in this exercise, it's enabling the client to realise that they have a choice to make, and they can choose towards greater health, happiness, and well-being. If they get hooked, that's known as cognitive fusion in the ACT model, and these are having thoughts and feelings that have a negative influence on behaviour, and then this results in inflexible and rigid behaviour. Worth noting that experiential avoidance is normal until it becomes fused with the emotional control agenda. Unhooking is diffusion, and this is invoking the open and aware pillars, and getting on with the towards is using the engaged pillar. So the ACT hexaflex, or three pillars, can apply in a negative sense to the away moves, and they can act in a positive sense in the towards moves. This is the choice point that was developed by Russ Harris and his colleagues, and it enables the patient to see that they have a choice about their life and their situation. And so we have situations, thoughts and feelings down here and the choice point. And away moves is when the patient or client is moving away from their values. And then there's towards moves which are in sync with their values. So in Sara's case, over here would be avoiding flatmates. Avoiding thinking of boyfriend, avoiding social engagements, and avoiding her family. So in terms of getting her unhooked, you may wish to talk about what are the things that she could do that would take her towards these things. And one of them would be going to yoga classes. So over here it would be not exercising. And it just reminds the client that they actually do have a choice about these things, that life doesn't need to necessarily control them. And this could be socialising with her flatmates. These can work very well when a client has a drug or alcohol problem. They can look at at the benefits and harms they're getting from taking the drugs and alcohol, and the benefits and harms of not having drugs and alcohol. So it's a very useful pictorial tool to use with patients to help them in that choice and making changes in their life.